the days following birth, mothers nourish their babies with colostrum. It's your milk for those days right after birth. You'll produce it in very small, highly nourishing quantities. Colostrum is golden or yellowish, dense and viscous, and does not come in a standard amount. It contains huge quantities of the fatty acid DHA, white blood cells, proteins. Colostrum reinforces baby's immune system and helps prevent jaundice and hypoglycemia. This is a completely normal step in lactation. Your milk will come in 3 or 4 days after birth. There is a rapid increase in milk production, and sometimes if baby doesn't nurse efficiently or doesn't latch on efficiently, mother's breasts can seem larger and harder. If your breast becomes too firm or swollen, your areola is taut and shiny, and your child may find it difficult to nurse efficiently. For latch on to be efficient, your areola should be soft to the touch. If your areola is as soft as your earlobe, then your child should be able to nurse efficiently, even if your breast feels too firm or swollen. You can relax your areola by using warm pouches or compresses and by very gently kneading your breast. Work your way around your breast 2 or 3 times. You should feel no pain when you apply this type of massage. If you do, stop. Follow these steps and it should be easier for you to latch baby onto your breast. Manual expression is an efficient way to express your breast milk. It is the most efficient way to express colostrum. Place your thumb on one side of your breast and your index and middle finger on the other. Keep your fingers on your breast and push your hand back towards your chest. Now, slide your fingers firmly towards the beginning of your areola without going beyond it, and pinch your breast. Repeat the same movement, working your way around your breast. Manual expression will get more efficient as you become more experienced. Compressing your breast will help make nursing more efficient. During the first few days after birth is particularly useful, as this will help you to express colostrum. You should apply compression if baby tends to fall asleep quite soon after latching on. Your baby isn't gaining weight. Your baby tends to chew your nipple. You supplement nursing with other types of milk. Thanks to compression, you will produce more milk for your baby and continue to do so during future feeds. Keep your fingers away from your areola. Squeeze your breast for 5 to 10 seconds. If your child doesn't nurse, or if he or she plays with your nipple, that is, suckles without swallowing, stop squeezing and observe your child. If your child doesn't nurse, then compress your breast again. If your baby nurses, then you can stop squeezing. Compression mustn't cause you pain. You don't need to use compression if your baby nurses without help and you feel he or she is feeding efficiently. On the 27th of April 2006, the World Health Organization published new growth charts. Here we can see development in the growth curve during the first 6 months. During the baby's first 2 months, growth is quite rapid. Growth slows down between the 3rd and the 6th month. The diagram shows baby's weight at birth. Baby's subsequent growth is shown in grams. Week 1, Week 2, Week 3, 1 month, 2, 3, 4 months, 5 months, 6 months. At 6 months, baby weighs a little under double his or her birth weight. Every baby is represented on a curve measured in percentiles. Let's clear up a misunderstanding about these percentiles. 30th percentile. 30% of babies grow following the values shown below the curve, while 70% grow according to the values shown above the curve. 50th percentile. 50% of babies grow following the values shown below the curve, while 50% grow according to the values shown above the curve. 70th percentile. 70% of babies grow following the values below the curve, while 30% grow according to the values shown above the curve. As they grow, children may well pass from one curve to another. Children grow as they need to, and in keeping with their genetic background. Growth curves are useful because they can help us in realising if our children are growing properly. Baby's weight is in relation to height and cranium circumference. A baby who is always at the 30th percentile is growing normally, just as a baby who is always at the 31st percentile is growing normally, as is a baby who is always at the 99th percentile. Mother is feeding her baby efficiently if baby appears satisfied after nursing. Baby nurses on demand. Baby is growing according to his or her growth curve. If latch on is not efficient, baby will not nurse properly, will not stimulate your breast sufficiently, you will produce less milk, and baby will fail to gain weight. The amount of milk your baby receives can change from one feed to the next, and from one day to another. Under normal circumstances, the quantity of milk a mother produces corresponds to her baby's needs. However, if milk production is insufficiently stimulated, mother will produce less milk. The same thing may happen if mother uses a bottle to feed her baby. You can tackle this situation by the following steps. First, check that your child's latch is efficient. Is your baby in the right position? Observe how your baby latches on and watch closely while he or she nurses. If you have the impression that your baby is not satisfied, then bring your child back to your breast and practice a technique we call ping-pong. This will help you nurse more efficiently. The technique will help you boost milk production during your current feed and prepare your breast to produce more milk at later feeds. What is this ping-pong technique? Start nursing at the breast of your choice. Give your child time to nurse. If you feel your child starts to swallow less frequently, then compress your breast as we explained earlier. If your child continues to swallow infrequently, change breast before your baby falls asleep. Repeat the sequence, changing the breast your baby nurses at if you find your child is not swallowing frequently. You have used the ping-pong technique, but you have the impression your child is still hungry. At this point, you might try giving your baby a supplement of your own milk using a lactation aid. This is a standard feeding tube for newborns. Place one end very gently in baby's mouth and line up the other end with your nipple. If baby feeds while suckling and the lactation aid has been properly applied, then your milk will continue to nourish your child. If it doesn't work, it might be necessary to reposition the lactation aid along your nipple. Why is this way of supplementing better than others? Baby will receive mother's milk and a supplement at the same time. Baby will improve his or her suckling technique. Mother will nurse more efficiently. Mother will boost lactation production. And even if mother doesn't produce a lot of milk, she can easily carry on breastfeeding, as nursing is so much more than milk. And what about using other suckling methods to give supplements? Baby will receive less and less milk from mother's breasts. Baby may well stop nursing in an efficient way. Mother might experience difficulties with nursing. She will produce less and less milk. If mother doesn't produce a lot of milk, it is very likely she will no longer be eager to carry on breastfeeding. Both mothers and babies learn how to nurse by nursing. To sum up, correct your or baby's position or posture. Use the ping-pong technique. Add supplements using the lactation aid. What supplements can you use? Mother's milk, expressed by pump at the end of a feed. Milk donated by another woman. Formula. You may choose or need to give your child a supplement of your milk. In this case, try to use an electric breast pump, single or double at the end of each feed. If you feel that the amount of milk you manage to pump is not a lot, don't be put off and don't lose heart. Keep trying. Stimulation will become more and more efficient. Not all women enjoy using breast pumps, of course. Remember that the amount of milk you express using the breast pump does not necessarily correspond to how much milk baby receives when he or she nurses. Introduce supplements. Continue nursing. The situation will gradually get better. And always remember, breastfeeding is much more than nursing your child. Parents of children who are born preterm must deal with several challenges. If anything, preterm babies have even more need to receive breast milk than do babies born at term and in good health. Preterm babies and their mothers face greater difficulties to breastfeed than do babies born at term. Ask for help and practical support as soon as possible. The child you see here was born at 29 weeks. She spent 2 hours a day in skin-to-skin contact with her mother. This kind of contact is vitally important for all babies, preterm or not. Thanks to skin-to-skin contact, babies are more likely to want to latch on, and to latch on efficiently. Baby's skin temperature will be more stable, glycemia levels will be higher, and baby will cry less. The child you see here is trying to make his way to the breast. He latches on well and nurses vigorously. These twins were born at 35 weeks. Here they are 5 days old. They are enjoying skin-to-skin contact with their mother. One of the twins tries to latch on. For premature babies, breastfeeding is much less distressing than other ways of nursing. Some babies might start crying a lot and nursing could become more difficult for mother and child. In these situations, it's a good idea to observe how well baby latches on and check how efficiently he or she nurses. Some signs to look for. Baby seems to choke while nursing. Baby might cough, spit, send milk the wrong way, pull abruptly away from the breast and start crying. Baby might be affected by very bad colic. Baby might give the impression of always being hungry, although growth is fine. Try one or more of the following solutions. Check latch on and correct if necessary. Always choose a comfortable position and posture which makes sure you don't lean towards or over your child. If possible, stay reclined while breastfeeding. Allow baby to nurse on one breast for as long as he or she wants before moving on to the second breast. Use the breast pump as little as possible. Some women nurse from only one breast or keep to the same breast during subsequent feeds, while others prefer to nurse from both breasts. In other words, mothers should nurse from one breast and then change over to the other only when they feel their child has actually stopped feeding. Mothers might well find themselves nursing from only one breast during one feed and from 2 breasts during later feeds, alternating in this way until their child is no longer hungry. With time, the closeness that develops between you and your child will make breastfeeding easier and easier.